working to connect a region of over 600 cultural bridges between our lands.
Hello, Malma Angeles. Welcome to ASEAN in Focus. We're coming to you live from Manila and Thailand. Hello, Faye.
Hello, I'm Faye Barton, bringing you the news in the dynamic Asean region.
On today's headlines. The Philippines reported its first local cases of the more infectious Delta coronavirus variant.
European Union member states on Thursday agreed to add Ukraine to a list of countries from which travelers can enter the European Union during the coronavirus pandemic, and while Rwanda and Thailand were removed.
Indonesia's former fisheries minister, Edi Prabowo, was sentenced to 5 years in prison after he was convicted in a corruption case linked to baby lobster exports.
Singapore police are investigating several karaoke bars for breaching coronavirus restrictions and have arrested 20 foreign women for alleged vice-related activities after an outbreak linked to the night spots, and authorities said.
First to the Philippines, where the country today reported its first local cases of the more infectious Delta coronavirus variant. 16 new Delta variant cases were detected in the country, including 11 classified as local cases, according to Health Undersecretary Maria Rosario Vergere in a briefing. 5 are returning overseas Filipinos. Now, 6 patients are now in the southern island of Mindanao and are part of a large cluster of cases, while 2 were detected in Metro Manila, according to her. The Philippines, which has the second highest COVID cases in Southeast Asia, will boost testing and tracing and ensure that hospitals are ready for a surge, according to Undersecretary Vergere.
Now in Asia, Indonesia Thursday posted a record 56,757 daily infections as the Delta variant spreads through the world's 4th most populous nation, which is overtaking India as the region's COVID-19 epicenter. The China-based Asian Infrastructure Investment Bank said it was loaning the Southeast Asian nation $500 million to boost its response as Indonesia's deadliest wave yet brings scores of hospitals to the brink of collapse. And officials have said that the virus was spreading faster than expected, fueled by the Delta variant. Vaccine doses are flowing into the hard-hit country by the millions, including from Japan and the United States, while Jakarta on Thursday approved the Pfizer-BioNTech jab for emergency use. Indonesia has said it is on track to receive about 50 million doses of the jointly made jab through this year. So far, the outbreak has been centered on the island of Java, which is home to Jakarta, the capital and largest city, per Reuters. The hospital system is being pushed to the brink and reported the deserted news. Experts widely believe that Indonesia is still undercounting cases due to the country's lack of testing infrastructure, and Indonesia's positive test rate is 31%, indicating that only serious cases are being tested, leaving high levels of community transmission potentially undetected, according to Bloomberg. Meanwhile, there are fears that Eid al-Adha celebrations, which start next week, could spark another explosion in cases across the world's biggest Muslim majority nation.
And take a look, Indonesians are now lining up to refill oxygen tanks as the country's virus infections rise significantly. Take a look.
Now, the Philippines on Wednesday banned travelers from Indonesia, Asia's new coronavirus epicenter, after it overtook India in daily infections. Indonesia is now considered Asia's new coronavirus epicenter after it surpassed India's daily infections. Meanwhile, the Philippines has extended its travel ban on India and 6 other countries. Let's take a listen.
Sa travel restrictions sa bansang Indonesia, effective 12:01 p.m. kanina pong umaga, 12:01 a.m. ng July 16, 2021, mamaya pa pala po yan, Manila time, hanggang 12:59 p.m. ng July 31, 2021, ay bawal pong pumasok sa Pilipinas lahat ng mga pasahero galing o nanggaling sa Indonesia sa loob ng 14 na araw immediately preceding arrival in the Philippines. Hindi po kasama rito ang mga Pilipinong babalik kasama sa government-initiated repatriation programs o parte ng non-governmental repatriation programs at special commercial flights na pinapayagan sa ilalim ng IATF resolutions. Effective immediately, lahat ng mga pasahero na galing sa Indonesia sa loob ng 14 na araw bago dumating ng Pilipinas at dumating bago ang 12:01 a.m. ng July 16, 2021 ay po pwedeng pumasok ng Pilipinas. Ngunit kailangan nilang sumailalim sa absolute facility-based 14-day quarantine period, lahat na mayroong silang negative RT-PCR test result. Lahat ng mga pasahero, Pilipino o dayuhan ay masasabing merely transiting sa bansang Indonesia kung sila ay namamalagi sa paliparan sa Indonesia sa lahat ng oras at hindi na clear for entry sa Indonesia. Pagdating ng mga pasaherong nag-transit sa bansang Indonesia ay hindi na nangangailangan ng full 14-day facility-based quarantine pero kinakailangan nilang sumailalim sa pinaiiral na testing at quarantine protocols. That's 10 days facility quarantine at PCR test on the 7th day. COVID-19 updates naman po tayo. Ito po ang ranking ng Pilipinas sa mundo ayon sa Johns Hopkins. Nananatiling number 23 po ang Pilipinas pagdating sa total cases. Bumaba po tayo lalo pagdating sa active cases. No? Nasa number 31 na po tayo. Number 130 po tayo sa cases per 100,000 population at number 88 sa case fatality rate, 1.8%. Meron tayong 3,806 na mga bagong kaso ayon sa July 14, 2021 datos ng DOH. Samantala, nasa 95.2% ang ating recovery rate. Kaya naman nagpapasalamat kami sa ating mga medical frontliners.
Meanwhile, European Union member states today agreed to add Ukraine to a list of countries from which travelers can enter the European Union during the coronavirus pandemic, while Rwanda and Thailand were removed. The EU's eastern neighbor joins a green list of only around 20 countries, which also includes the likes of Canada, Japan, New Zealand, and the US, according to the bloc in a statement. Brussels' classification doesn't prevent member states from imposing requirements like testing or quarantine on incoming travelers from countries on the list. The EU originally closed its external borders to non-essential travel in March 2020, but has since set up the regularly updated green list of countries and territories people can enter from, including the unvaccinated. Vaccinated travelers are allowed in from any non-EU country. But for now, the list includes Albania, Armenia, Australia, Azerbaijan, Bosnia-Herzegovina, Brunei, Canada, Israel, Japan, Jordan, Kosovo, Lebanon, Montenegro, New Zealand, Qatar, Moldova, North Macedonia, Saudi Arabia, Singapore, Serbia, Taiwan, South Korea, and the United States.
The world must invest much more to avoid a repeat of the coronavirus pandemic. Experts convened by the G20 say, as they warn, the next health crisis could come within a decade. Let's take a look.
Also have to pay attention to the fact that in the continuing pandemic, vaccine inequity of access between developed and developing countries is a real problem, and we need to address it.
But in preparing for the next pandemic, and the next pandemic will come. Not talking about a once in 50-year event, we are talking about a pandemic that can come anytime, 20 years' time, 10 years' time, maybe next year.
The report recommended governments collectively commit to increase financing for prevention and preparedness by at least 75 billion US dollars over the next 5 years. This would fund a coordinated surveillance and research network for infectious diseases, more resilient healthcare systems, and better governance to manage crisis and improve global capacity to produce vaccines.
The additional restrictions in Metro Manila amid the general community quarantine status have been lifted, according to Malacanang yesterday. Now, this developed after the Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF-EID, in a meeting held Wednesday, decided to recommend to President Duterte the further easing of restrictions in Metro Manila. Take a look.
Zamboanga. Ang mga lugar naman pong babasahin ko ay nasa ilalim ng GCQ. Ang National Capital Region, ang Baguio City at probinsya ng Apayao, ang City of Santiago, ang probinsya ng Isabela, Nueva Vizcaya at Quirino, ang probinsya ng Bulacan, ang mga probinsya ng Cavite, Rizal, Quezon at Batangas, ang Puerto Princesa City po, ang mga probinsya ng Guimaras at Negros Occidental, ang probinsya po ng Zamboanga Sibugay, City of Zamboanga, Zamboanga del Norte, ang Davao Oriental, ang General Santos City, Sultan Kudarat, Sarangani, Cotabato, South Cotabato. Sa Caraga po, ang Agusan del Norte, Surigao del Norte, Agusan del Sur, Dinagat Island, Surigao del Sur, at sa Barm ang Cotabato City. Lahat po ng mga probinsyang hindi ko po binasa ay nasa ilalim po ng MGCQ.
Now in Malaysia, we're going to get the latest coronavirus situation. Here's Alfred Balmes. Alfred?
Hi, Faye. Good afternoon. In Malaysia, COVID-19 cases continue to climb as the country recorded a record of 13,215 infections on Thursday. The number beat the country records of 11,079 cases just the previous day. Health Director General Tan Sri Dr. Noor Hisham Abdullah said in his official tweet, the country total accumulative number of cases stands at 880,782, with the state Selangor recording the highest figure with 6,120 cases. The state of Negri Sembilan is second highest with 1,603 cases, followed by the state of Kuala Lumpur with 1,499. All the other states in Malaysia recorded three-digit figure of COVID-19 cases. Health Director General Tan Sri Dr. Noor Hisham Abdullah said in his earlier statement, the high number was in tandem with the increased targeted screening in the Klang Valley from the state of Selangor. Meanwhile, Noor Hisham said there is still capacity to conduct more COVID-19 tests, especially of private laboratories, adding there 41 private laboratories in the county capable of conducting COVID-19 tests. However, 118 more people in Malaysia have succumbed to COVID-19. This brings the COVID-19 death toll to 6,503. Nationwide, there are now 101,359 COVID-19 patients who are hospitalized or under monitoring. There were also 26 new COVID-19 clusters identified by the Health Ministry. Of that, 15 are linked to outbreaks at the workplace. Another 7 are community outbreaks, while 4 others have been categorized as the high-risk group cluster. Back to you, Faye.
Thank you so much, Alfred, for that report. You keep safe there in Malaysia.
Likewise, live reporting from Kuala Lumpur, Malaysia. This is Alfred Balmes. We live in interesting times.
And let's head on back to Thailand, where the production of the AstraZeneca vaccine at a factory there has fallen short of its target. Let's find out how long the delay is. Here's Veronica Carino joining us live. Hello, Veronica.
Hello, Alma. Yes, Thailand's plan to acquire a total of 61 million doses of AstraZeneca coronavirus vaccine until May is likely to delay due to its production in its factory here has fallen short of its target. As Thailand logs record high daily increases in COVID-19 cases and deaths, the expected supply shortfall may hinder attempts to inoculate at least 70% of the country's 69 million people this year. With the spread of the virus' more contagious Delta variant, the number of cases has increased. According to Deputy Health Minister Satit Pitut-Tatcha, AstraZeneca has requested an extension until May to complete delivery. And while the schedule is flexible, the government will continue to negotiate for as much monthly supply as possible. Moreover, Alma, according to AstraZeneca, the facility controlled by Bioscience, a firm owned by Thailand's king, has a current production capacity of 15 million doses per month, and AstraZeneca has promised to deliver 40% of that to Thailand. According to Satit, production may expand in the future. The ministry had previously stated that Thailand would receive 6 million doses of AstraZeneca vaccine in June, 10 million doses per month from July through November, and 5 million doses in December, for a total of 61 million doses this year. Despite having no prior experience manufacturing vaccines, AstraZeneca granted Siam Bioscience a license to be a regional production base servicing 8 other national last year. Prime Minister Prayut Chan-o-cha's government has been criticized for failing to secure appropriate and timely vaccination supplies and has been trying to procure vaccines other than Sinovac and Sinopharm from China and has been trying to end AstraZeneca made domestically. According to the government, Alma, it now has agreements to buy Pfizer and Johnson and Johnson's as well. Thai health officials said Wednesday that because of country doesn't have enough of the locally produced AstraZeneca vaccine to meet its own needs, they will attempt to ban exports. They didn't say what the boundaries might be. The National Vaccine Institute Director Dr. Nakon Premsir said that the Institute Vaccine Committee agreed in principle to issue an order temporarily banning exports, but he didn't elaborate. The order would be issued after it was designated as a national security subject. After being hit by a deadly coronavirus outbreak early this year, India, the world's largest vaccine producer, barred vaccine exports. Thailand has given out 13.53 million vaccination doses to a total of 10.16 million people, or 14.74% of the population. 3.37 million people, or 4.89% of the population, have received all of their vaccines. The government's plan to launch a recovery of Thailand's major tourist economy by allowing vaccinated passengers to enter without having to quarantine on arrival is starting in mid-October is jeopardized by poor pace of vaccines, which is hampered by supply issues. This update is from Thai PBS World. Back to you, Alma.
Thank you for your update, and you have a safe weekend. Thanks for your time.
Thank you, Alma. Stay safe and happy Friday. Reporting live from Thailand, this is Veronica Carino, and we live in interesting times.
Now in Indonesia, the Ministry of Health has reached an agreement with Pfizer Indonesia and BioNTech to procure 15 million doses of the Pfizer vaccine through the year. Let's hear more. Our Southeast Asia correspondent, December Paras. December.
Hi, Faye. Yes, the one that you mentioned earlier, as of yesterday, the new COVID-19 case here in Indonesia reached 56,757, which brings a total number of 2,726,803 positive cases of COVID-19 here in Indonesia. But for the good news, now in Jakarta, the Ministry of Health made an agreement with Pfizer Indonesia and BioNTech to procure 50 million doses of the Pfizer vaccine throughout 2021 to accelerate its vaccine program in Indonesia. Minister of Health Budi Gunadi Sadikin expressed his gratitude in a press statement on Wednesday for the cooperation in allowing the country to meet the needs of the COVID-19 vaccine in Indonesia. Budi said, with the additional stock of 50 million doses of the Pfizer vaccine, we hope to accelerate the rate of vaccination in Indonesia. Indonesia has injected 39.6 million people, or 19% of its vaccination target, with at least one dose of the COVID-19 vaccine. The country targeted to inoculate 208.3 million people, or 77% of its population by May next year. According to Jakarta Globe, the country has received more than 254 million vaccine deliveries, with Chinese pharmaceutical companies Sinovac, Biotech, and Sinopharm account for about 93% of the supply. The United States also supplied Indonesia with Moderna vaccine, while Japan and COVAX sent AstraZeneca vaccines to make up the rest. Budi showed confidence in Pfizer's ability to fulfill the order as the company and its partner BioNTech aim to produce 3 billion doses of their COVID-19 vaccine globally by the end of 2021. According to a timetable shared by the ministry last month, Pfizer would send 3 million doses next month, followed by 5.5 million in September and 13.8 million doses each in October, November, and December. Stephen Young, Pfizer Indonesia's country manager, expressed appreciation towards the agreement that has been established between BioNTech and the government. This collaboration is an important step to present the COVID-19 vaccine to protect public health, restore the economy, and accelerate the return towards normal life for the Indonesians, he said. Sean Marek, BioNTech's chief business and chief commercial officer, thanked the government of Indonesia for its support and confidence in the company's ability to develop a vaccine. Our goal is to provide COVID-19 vaccines that is effective and accepted to as many people as possible around the world as quickly as possible, Marek said. Back to you, Faye.
Thank you so much, December, for that report. You keep safe there in Indonesia. Thank you.
You too, Faye. Reporting from Jakarta, Indonesia, this is December Paras. We live in interesting times.
Meanwhile, in Maldives, the health ministry there said that South Asian tourists will be allowed to transit in guest houses in the capital once the country reopens its borders to tourists. Here's more from Steffi Diwan, joining us live from the island nation of Maldives. Steph.
Yes, Alma, good afternoon.
Afternoon.
Health Protection Agency states that South Asian tourists will be allowed to transit in guest houses in Maldives capitals after the country reopens its borders to tourists from the region this week. Maldives is scheduled to reopen its resorts to South Asian tourists to July 15, which is yesterday, Alma. However, guest houses in residential islands will remain closed to tourists from the region until July 30. HPA announced on Tuesday that while South Asian tourists will not be allowed to check in to guest houses in residential islands, outbound tourists will be allowed to transit in select guest houses in the Maldivian capital under guidelines set out by the Tourism Ministry. HPA also said that guidelines for South Asian tourists on check-ins to guest houses in residential islands will be released before July 30. Maldives imposed the ban on South Asian work permit holders from entering Maldives on May 9 following a surge in COVID-19 cases in the region fueled by the highly contagious Delta variant first discovered in India. Restrictions were further tightened with a decision to suspend issuance of on-arrival visa to South Asian travelers on May 13. Maldives eased the restrictions and reopened for South Asian worker permit holders on July 1st. They are subject to 14 days of mandatory quarantine and a PCR test to confirm they are negative for COVID-19. Meanwhile, HPA also warned on Wednesday of possible delays in delivering results of COVID-19 PCR tests amid a rise in testing among holiday travelers. Maldives also rolled out significant easements in travel restrictions this July. The easements allow fully vaccinated individuals to travel to islands that aren't under monitoring with proof of a negative PCR test without being subject to mandatory quarantine. The ease applies to fully vaccinated individuals who are received their second vaccine shot at least 14 days before the date of their departure. Children who are ineligible for COVID-19 vaccination are also allowed to travel with proof of a negative PCR test without being subject to mandatory quarantine. The easements, which come ahead of the Eid al-Adha holidays, has led to a surge domestic travel. However, HPA said that given the increase in samples for PCR tests, it has therefore decided to prioritize processing samples of direct contacts and samples of individuals with symptoms consistent with COVID-19. And that's my quick update from Maldives. Back to you, Alma.
Thank you, Steph, for your updates in the Maldives. Stay safe. Have a safe weekend.
Thank you so much, Alma. Have a safe weekend too. Reporting live from Maldives. This is Stephanie Juan, and we live in interesting times.
Now in Cambodia, public and private institutions are urged to conduct a rapid testing of staff at least once every 1 to 2 weeks. Let's hear more from Crystal Ann Ballesteros, our EDC correspondent from Cambodia. Hello, Crystal.
Hi, Faye. Good afternoon, and to all our online viewers. According to Khmer Times, the royal government of Cambodia has urged all public and private institutions to conduct COVID-19 rapid tests on a proportion of staff at least once every 1 to 2 weeks. The recommendation was given in guidelines on the management and use of the rapid test for COVID-19 issued yesterday. In the 26-page General Guidelines for the Management and Use of the COVID-19 Antigen Rapid Test, the government says that to maintain work sustainability in a location, such as public and private public health service institutions, non-governmental institutions and entities, private companies, factories, enterprises, including accommodation concentrated in construction sites, markets, banks, recreation centers, and venues, it recommends testing at least 5 to 10% of staff. It gives the following recommendations: that it should plan a randomized test that is periodic and appropriate to the institutional or organizational risk and is routinely performed on at least 5 to 10% of the staff in the institution or unit per sample. The plan should also ensure that all employees present on the premises of the institution or unit receive regular rapid tests at least once every 1 to 2 weeks. Each institution or entity must publish a clear and comprehensive plan for its rapid COVID-19 antigen test. Identify high-risk employees such as employees who interact with other employees or people outside the institution or organization, and conduct frequent quick tests on those employees. If there is a positive case or an outbreak of COVID-19, the operating guidelines on the use of the COVID-19 antigen can be used for private healthcare institutions, non-governmental institutions and entities, gateways, private companies, factories, enterprises, and other places of business, and for private individuals or the Ministry of Health, launched on July 7. In the event of a positive rapid test result in an individual who is considered to be at low risk, for example, residing in an area with low prevalence of infection and not having direct contact with a person with COVID-19, each institution shall ensure the person is isolated and requested a PCR test before referring the person for treatment. And lastly, competent authorities can provide coordination, cooperation, and support to the private sector or individual business owners in the preparation and implementation of rapid test programs available at their local level as needed. Back to you, Faye.
Thank you so much, Crystal, for that report. You keep safe.
You too, Faye, and have a safe weekend. Reporting live here in Cambodia, I am Crystal Ann Ballesteros, and we live in interesting times.
And the news continues here on Eagle News. Faye and I will be back right after this break.
Tagisan ng Galing is supported by Magnolia Incorporated. Magnolia ready-to-cook fried chicken. Worry-free na on your next family meal. Yan ang alagang Magnolia. Pure Foods Tender Juicy Hot Dog. Walang duda, kids can tell na #1 ang Pure Foods Tender Juicy Hot Dog. Sandig sugar-free white coffee. Sarap ng white coffee, now sugar-free. BMAG Premium and ProTac Plus Gold. SMC Infrastructure and Skyway Stage 3 Citrus Central Expressway Corporation. San Miguel Foundation Incorporated. Max Pro Northern Cement. Lamang ka dito. Metron Corporation. SMC Global Power. San Miguel Aero City Incorporated. Bank of Commerce, an affiliate of San Miguel Corporation. We think customers. We are IT Philippines Incorporated. China Bank, your success is our business.
Hubert, your ultimate MAPS air conditioning solutions.
Welcome back. Vietnam is looking to increase control over live streaming on popular social media platforms such as Facebook and YouTube, according to a draft government decree, as the country aims to tighten its grip on cyberspace. The proposed decree comes 2 years after the introduction of a cybersecurity law that mandated internet companies remove content the communist authorities regard as toxic. The law received sharp criticism from the United States, the European Union, and internet freedom advocates who said it mimics China's repressive censorship of the internet. Under the terms of the decree, any account that operates on a social media platform in Vietnam and has more than 10,000 followers must provide contact information to authorities. Only registered accounts will be allowed to live stream. The proposed decree also says that social media providers must temporarily block or remove content within 24 hours if they receive a justified complaint from an individual or organization affected by the content.
Indonesia's former fisheries minister Edi Prabowo was sentenced to 5 years in prison Thursday after he was convicted in a corruption case linked to a baby lobster exports. Prabowo, 48 years old, was among more than a dozen suspects arrested last year on charges that they took bribes for issuing permits to export the crustaceans, and the shipments were banned under Prabowo's predecessor due to sustainability concerns. The defendant has been proven guilty of committing corruption. Presiding Judge Albertus Usada said Thursday as he passed sentence in a video hearing held due to COVID-19 restrictions. And I quote, Prabowo did not set a good example as a public official, end of quote. The Jakarta court also ordered Prabowo to pay more than 11 billion rupiah in fines and restitution or face as much as 2 additional years in prison. Graft remains a big problem in the Southeast Asian nation, where politicians are widely seen as among the most corrupt public officials.
Malacanang belittled an idea raised by the Partido Democratico Filipino Lakas ng Bayan or PDP Laban faction that President Duterte could get expelled if he attends the July 17 assembly organized by Energy Secretary Alfonso Cusi. Presidential spokesman Harry Roque said the PDP Laban faction is free to do whatever they want, but reminded them that the ruling party only gained more members after the president who chairs the party won as president.
Bahala po sila kung anong gagawin nila. Pag nagdesisyon ng presidente yung tumakbo ng vice-presidente, kahit anong partido pa, kahit walang partido, tatakbo po yan. Alam naman po natin, halos wala namang miyembro po ng PDP Laban bago naging presidente si Pangulo Duterte. No? So hindi ko po alam kung kung saan ang gagaling yung ganyang salita ng PDP Laban. Ulitin ko po, isang jeepney lang po ang PDP Laban bago po sumali dyan si Presidente Duterte. Kung aalisin niyo po si Presidente sa PDP Laban, balik kayo sa isang jeepney.
On Monday, Roque confirmed that the president will be attending the Cusi-led assembly in Clark, Pampanga on July 17. PDP Laban National Education Committee Chair Rufina Pines Arcega earlier said many of her colleagues do not agree with President Duterte running for vice president in the 2022 national elections. If that were to happen, she said the president could be removed from the party. Senator Aquilino Coco Pimentel III, whose family was one of the founders of the party on Tuesday, called on his party mates to ignore the July 17 assembly organized by Cusi. Cusi was kicked out from the party for allegedly violating rules over his alleged support for Duterte's vice presidential bid. Conflict in the PDP Laban faction started after Cusi and Senator Manny Pacquiao disagreed over the former's support for Duterte's candidacy as vice president. The president earlier implied that Pacquiao's corruption allegations stem from the fact that he was impatient to be named as presidential bet of their party.
In other news, as the family of slain Cambodian activist Cam Lay rebuild their lives in Australia, and his youngest son, born months after the assassination, acts as a human timepiece measuring the years since the five brothers lost their father. Let's take a look.
ជីវិតពនាចោជីវិតដែលខ្ញុំភៀសខ្លួននេះគឺការតស៊ូរបស់ខ្ញុំវាពិបាកដែរតែទោះបីយ៉ាងណាក៏យើងនៅតែតស៊ូយើងនៅតែខំត្រង់រហូតមកដល់យើងអាចឆ្លងផុតពីប្រទេសដែលមានគ្រោះថ្នាក់ណាអញ្ចឹងយើងមកដល់ប្រទេសនេះគឺល្អមែនតើសម្រាប់ការសិក្សាកូនការរស់នៅគឺល្អហើយដូចថាមានបងប្អូនប្រជាប្រដ្ឋខ្មែរច្រើនដែលតាំងពីខ្ញុំមកដល់នេះមកដល់ប្រទេសអូស្ត្រាលីនេះគាត់ឧបត្ថម្ភគាត់ជួយជ្រោមជ្រែងឲ្យច្រើនសម្រាប់ពួកគាត់គឺធម្មតាយើងធ្លាប់មានប៉ាអញ្ចឹងវាបាត់ភាពកក់ក្ដៅពីឪពុកហើយអញ្ចឹងទោះយ៉ាងណាក៏គាត់ស៊ូទ្រាំនៅក្នុងការដែលរស់នៅដែលអត់មានប៉ាណាចាដូចជាធម្មតាតែក្មេងដែលអត់ពីឪពុកហើយយើងត្រូវតស៊ូរឹងមាំខ្លួនចំណុចរឿងឃាតករហ្នឹងគឺខ្ញុំបានច្រានចោលតាំងពីដើមដំបូងតាំងកើតហេតុដំបូងមកទទួលស្គាល់ទេពីព្រោះយើងដឹងស្រាប់ហើយថារឿងឃាតកម្មមួយទាំងមូលបែរជាមានឃាតករតែម្នាក់ហើយមិនមានស៊ើបអង្កេតមិនមានស្រាវជ្រាវអ្វីទាំងអស់គឺបិទចោលបិទសំណុំរឿងនឹងចោលអញ្ចឹងអ្វីហ្នឹងគឺសិតតែរឿងដែលជាសម្ដែងណាចា
Cam Lay, a popular analyst and critic who dabbled in grassroots politics, was shot at point-blank range at a gas station cafe in Phnom Penh in 2016. An unemployed former soldier confessed to the killing and claimed the motive was an unpaid debt. In a trial, critics say was a political cover-up. Bo Rachna was 5 months pregnant at the time of the killing and named her fifth son, Cam Lay, Virek Bot, after her late husband. Cam Lay was a vocal critic of Cambodian politicians of all stripes, but he was particularly scathing about the corruption that blights the country. Shortly before his murder, he gave an interview about an investigative report, and he had written the detailed sum of the millions of dollars allegedly amassed by the family of long-serving Prime Minister Hun Sen. The Cambodian government strongly denied any role in the killing.
Meanwhile, 3 more Thai islands opened to vaccinated foreign tourists on Thursday, despite a nationwide surge in COVID cases propelled by the Delta variant. The islands, Samui, Tao, and Phangan, welcome visitors as part of the kingdom's push to revive its battered tourism industry. Thailand launched its Sandbox scheme on July 1, allowing vaccinated travelers to visit Phuket Island. Tourists don't have to quarantine in a hotel but cannot leave Phuket for 2 weeks. Under Thursday's expansion, tourists must stay at an approved hotel on Samui for a week and can leave their accommodation on day 4. They will have to produce a negative COVID test before being allowed to venture to Tao or Phangan after their first week. Prime Minister Prayut Chan-o-cha said communication was important, so tourists understood the conditions for the Phuket and Samui schemes differed. The leader has been in isolation for almost 2 weeks after coming into contact with a positive case during the Phuket scheme launch. The rest of the country is to struggle to rein in infections from the Delta variant, which authorities say now makes up nearly 80% of its caseload. Virus hotspot Bangkok and 9 provinces are under tightened restrictions, including a nighttime curfew and a ban on gatherings of more than 5 people.
Now in the Philippines, the Department of Education, or DepEd, announced on Friday that President Rodrigo Duterte has approved September 13, 2021 as the opening date for school year 2021 to 2022. In a statement, the DepEd said the date was among the options recommended by DepEd Secretary Leonor Briones. I quote, "We thank the President for his full support to the delivery of quality basic education for the incoming school year," end of quote. This is according to the statement. Since the pandemic last year, schools have adopted a blended learning approach, and resumption of limited face-to-face classes in areas considered as low risk is still postponed. Despite the challenges, Briones assured the public that classes would continue and no learner will be left behind.
And Singapore police are now investigating several karaoke bars for breaching coronavirus restrictions and have arrested 20 foreign women for alleged vice-related activities after an outbreak linked to the night spots, according to authorities. The city-state has seen a spike in cases this week connected to the bars, including a 10-month high of local transmissions on Wednesday, and the number of infections in the cluster now stands at 87. A staple of Singapore nightlife, the karaoke bars typically have blacked-out windows and are frequented by foreign female hostesses. Police said in a statement late on Wednesday they were investigating 3 night spots for breaching virus measures by allegedly providing hostessing services. Under current virus restrictions, the bars were only supposed to be operating in a limited fashion, providing food and drinks. 20 women aged 20 to 34 from South Korea, Malaysia, Thailand, and Vietnam have been arrested for suspected involvement in vice-related activities at the bars, according to police. The first reported infection in the cluster was a Vietnamese hostess on a short-term visitor pass to Singapore who had been to many of the bars. Another infection linked to the cluster was a passenger on a cruise, which was forced to return to Singapore earlier than scheduled on Wednesday after the case was detected.
In Myanmar, the residents across Myanmar's biggest city are defying a military curfew in a desperate search for oxygen to keep their loved ones breathing as a new coronavirus wave crashes over the coup-wracked country. Let's listen.
ကျူပြီးတော့ဒါအခုဒါကျွန်တော်မအိပ်ပဲနဲ့3နာရီ15 20လောက်မှာပေါ့ကောင်းလေးလက်ရှောင်သွားသေးတယ်ဗျဘာလို့လဲဆိုတော့ကျွန်တော်မာရှယ်လို့ထုတ်ထားတာဟို4နာရီ10နာရီတော့ဒါသူတို့ကတွေ့မှလဲစိုးရတယ်အဲ့တော့3နာရီကြော်လောက်မှာထွက်လာပေါ့3နာရီခွဲလောက်ဒီရောက်တယ်ပေါ့ကျွန်တော်နံပါတ်15ကျွန်တော်ရှေ့မှာစီနီယာတွေအများကြီးရှိသေးတယ်
စားဖြစ်တယ်3ရက်ပဲရှိတယ်ပေါ့ပထမနေ့ကသူကမူးတယ်ဆိုပြီးတော့ပရက်ရှာရလို့မူးတယ်ဆိုပြီးတော့လုပ်တယ်ဟိုပေါ့ဒီဆေးတွင်းနဲ့ဆေးထိုးတယ်ပေါ့ဆေးလေးစားပြီးတော့နေရပေါ့ဒီအောက်ဆီဂျင်ရှိတယ်နေ့တည်းပေါ့နေ့တည်းကလည်းတော်တော်ခံစားလိုက်တာပေါ့သူကကြက်လို့ဒီတော့ဘာယောဂခံမှမရှိဘူးဒီမနေ့ကျမှအခုစမ်းစီတန်းနဲ့အိမ်မှာအောက်ဆီဂျင်လည်းညကျွန်တော်တူတကောင်ဟိုကနေအိုးကြီးလုံးပြီးအဲ့ဒါပြီးတော့အိုးပြတ်တော့အိုးပုံတော့ဆုံးတော့ကျွမ်းတယ်ဦးဆုံးအောက်ဆီဂျင်ပုံရတာဟုတ်
Meanwhile, the Ministry of Health has decided to approve Janssen COVID-19 vaccine for emergency use in Vietnam. This is a multi-dose vial which contains 5 doses. One dose is 0.5 ml, and it contains adenovirus type 26 encoding the SARS-CoV-2 spike glycoprotein, not less than 8.92 log 10 infectious units. Now, Janssen COVID-19 vaccines is the 6th vaccine approved after the US's Moderna, Russia's Sputnik V, and those made by the Pfizer, US's Pfizer and Germany's BioNTech, and China's Sinopharm and British-Swedish firm AstraZeneca.
In other news, Johnson & Johnson's single-shot COVID-19 vaccine is effective against the highly contagious Delta variant, with an immune response lasting at least 8 months, the company said on Thursday. The antibodies and immune system cells in the blood of 8 people vaccinated with the JJ jab or Johnson & Johnson's jab effectively neutralized the Delta strain, which was first identified in India, researchers found. A second study with 20 vaccinated patients at Boston's Beth Israel Medical Center had similar results. The data was sent to BioRix, a free online site for unpublished scientific preprints, where authors are able to make their findings immediately available to the scientific community and receive feedback on draft manuscripts before they are submitted to journals, according to the site. I quote, "We believe that our vaccine offers durable protection against COVID-19 and elicits neutralizing activity against the Delta variant," end of quote. This is according to Paul Stoffels, the Johnson & Johnson's chief scientific officer, in a company statement. Mathai Mamen, head of Janssen Research Development at Johnson & Johnson, said that data for the 8 months studied so far shows that Johnson & Johnson's single-shot vaccine generates a strong neutralizing antibody response that does not wane. Rather, we observe an improvement over time.
Meanwhile, the United Nations warned that a perfect storm was brewing with a raging pandemic, disrupting access to routine vaccinations, leaving millions of children at risk from measles and other deadly diseases. Take a look.
The COVID-19 pandemic has set us back a decade when it comes to the progress reached by childhood immunization. The coverage rate of diphtheria, tetanus, and pertussis has decreased by 3% from 86 to 83%. This means that we are missing out on life-saving immunization for 23 million kids, and 70 million of those have not even been reached by one single vaccine. And with the backsliding we see today, we have an imminent risk of outbreaks happening, measles outbreaks, polio outbreaks, and it's really important now to catch up, recover, try to reach those children being lost during the pandemic year. Otherwise, we'll trade just one crisis for another, and it's the children who are paying the silent price of this pandemic. The disruption in immunization services have been vast across actually most countries during the pandemic year. The reasons are manifold. There are lockdowns, there were difficulties in transports, there were fear and distrust when it came to risk of transmission in healthcare centers. And also healthcare workers were diverged. They weren't, they were put in places where they were needed in the pandemic response instead. All of this together risked the upholding of the routine immunization services. What is needed now is for all countries to look at their immunization services, to restore the immunization, to catch up those children that were lost, those that were not reached by immunization during this pandemic year, and catch them up and give them and offer them the vaccines that are needed.
Back here in the Philippines, motorists will now be able to use the first 18-kilometer portion of the Central Luzon Link Expressway, or SLEX, from SETEX Tiplex connection in Tarlac City up to the intersection of Aliaga-Gimba Road in Aliaga, Nueva Ecija. President Duterte, Department of Public Works and Highways, or DPWH Secretary Mark Villar, Senator Bongo, and Japanese Ambassador to the Philippines, His Excellency Kazuhiko Koshikawa, led the inauguration ceremony of the four-lanes toll-free expressway project connecting the provinces of Tarlac and Nueva Ecija. Take a look.
This day marks another milestone in our flagship Build program as we inaugurate this 18-kilometer and from Metro Manila and Central Luzon, which will be beneficial to entrepreneurs, consumers, and the economy.
It has been a delight on my part to witness the product Japanese-Filipino collaboration. We have long proven there can be a meaningful partnership between two countries in the infrastructure sector, and today's project is not the exception. I consider the opening of Central Luzon Link Expressway, SLEX, as another indication of a green shoot of recovery. What has been accomplished here is indeed extraordinary, considering all the challenges brought on by the COVID-19 pandemic. With the completion of 18 kilometers segment of SLEX, the congested Central Luzon, and seamless traffic flow between region and Metro Manila are now within reach.
Now, the SLEX is among the key infrastructure projects with funding assistance from the government of Japan through the Japan International Cooperation Agency, or JICA, in support of the Build program. The entire 30-kilometer expressway project is expected to shorten the usual travel time of 70 minutes between Tarlac City and Cabanatuan City to just 20 minutes, more than just scenic views experienced while you drive and visit the stunning places in Central Luzon. This new highway will help ensure the Philippines' sustainability and development by addressing barriers in distance and mobility.
The government's infrastructure spending is expected to be the major growth driver this year, but Standard Chartered Bank has reduced its growth forecast for the Philippine economy from 6.4% to 4.6%. In a virtual briefing on Thursday, Standard Chartered Bank for Asia, Chidu Narayanan, said growth may even be around the 3%, but the government's infrastructure investment will not pick up by around August, since private sector investment is projected to remain soft. He said this puts the onus of the government. On inflation, Narayanan said this may have peaked already and is not so much of a risk anymore, even if as remains above the government's 2 to 4% target band. He forecasts inflation to average at least or at 3.9% this year and within the government's target band.
And the Philippines has revised the roster of green countries and jurisdictions to ensure the smooth implementation of more relaxed testing and quarantine protocols for individuals who are fully vaccinated against the coronavirus disease or COVID-19. In a press statement issued Friday, presidential spokesperson Harry Roque released the updated list of 57 countries and jurisdictions where green lane policy for fully vaccinated travelers will be implemented. At least 11 states and jurisdictions have been added to the list. The states and jurisdictions included in the revised list are as follows: Albania, American Samoa, Anguilla, Antigua and Barbuda, Australia, Azerbaijan, Barbados, Benin, Bermuda, the British Virgin Islands, Brunei, Burkina Faso, Cayman Islands, Chad, China, Comoros, Ivory Coast, Curacao, Dominica, Eswatini, Falkland Islands, French Polynesia, Gabon, the Gambia, Ghana, Greenland, Grenada, Hong Kong, Iceland, Isle of Man, Israel, Laos, Liechtenstein, Mali, Malta, Marshall Islands, Mauritius, Federal States of Micronesia, Montserrat, New Caledonia, New Zealand, Niger, Nigeria, North Macedonia, Northern Mariana Islands, Palau, Romania, Sabah, Saint Bartholomew, Saint Pierre and Miquelon, Singapore, Saint Eustatius, South Korea, Taiwan, Togo, Turks and Caicos Islands, and Vietnam. The green countries and jurisdictions are those classified by the Department of Health as low-risk countries or jurisdictions based on disease incidence rate, according to the IATF EID's Resolution 123C issued on June 28.
Maria Jutanuragarn and Sister Maria combined to shoot an 11 under 59 for a two-stroke lead following the second round of the LPGA's Great Lakes Bay Invitational on Thursday. The Jutanugarns moved to 14 under to lead the duo of India's Aditi Ashok and Thailand's Pajari Ananarukarn in Midland, Michigan. The tournament, which was launched in 2019 but canceled last year due to the pandemic, follows an alternate shot or foursome format in the first and third rounds and better ball or four ball in the second and final round. Playing the best ball format on Thursday, the Thai sisters rolled in 6 birdies on the front 9 and 5 more on the back, including number 18, and it was one of the tournament best, a 58 recorded in 2019. In South Koreans Hormi Jung and Lee Jong-gyun, 62 Thursday, and Thai tandem Wichani Michai and Fabarisa Yoktuan, 63, were tied for third at 11 under. First round co-leaders Nelly and Jessica Corda struggled to a 69 Friday and are well back of the lead. Su Wei-ling and Li Min of Taiwan carded one of the best rounds of the day, a 10 under 60.
Thank you very much, Faye, for keeping me company today. You have a safe weekend over there.
You have a safe weekend also, Alman. Thank you for watching, everyone. Keep safe also and have a nice weekend. Once again, this is Faye Barte from EBC Thailand Bureau. We live in interesting times.
We'll see you back next week. I'm Alma Angeles, and we live in interesting times.
Ang susunod na programa ay rated PG. Ito ay nangangailangan ng patnubay at gabay